Often just the location of a knee pain will tell you what type of knee problem you're dealing with. So let's have a look at the most common type of knee issues. If you get pain at the front of the knee, under or around the kneecap, this is usually a common type of knee problem called patellofemoral pain syndrome or runner's knee. It tends to hurt under, just above or just below the kneecap with things like running, jumping and using stairs. 80% of people with this type of problem have pain while squatting, so that's the best way to test it. I actually have a video on how to correct it, so I'll leave a link in the description box below. Just be aware though that if you have pain just below the kneecap, that's noticeably worse when you fully extend the knee into its straightest position, then you may have an often undiagnosed problem called infrapatellar fat pad syndrome. If the pain is more in the tendon that runs between the kneecap and the shin bone, then it's likely you have tendinitis of the patellar tendon. This can cause swelling or tenderness over the tendon, tends to hurt with exercise, and often causes pain when fully bending or straightening the knee. Some people get pain and swelling right on the bony lump where the patellar tendon attaches onto the shin bone. This is something that develops in kids who do a lot of sport during their growth spurt, about 9 to 14 years old, and is a swelling of the bony growth plate in this location. Now, if you've torn a meniscus, the rubbery cartilages that cup the bones inside the knee, this usually affects the inside meniscus and will give you pain right on the joint line between the shin bone and the thigh bone. If you bend your knee to 90 degrees, on each side of the patellar tendon there's a dip, and if you go straight back from there, that's your joint line. Meniscus tears tend to be quite localized pain. It can make your knee feel like it gets stuck, or it feels like it's going to give way, and is often hard to fully straighten or fully bend your knee completely. An MRI can help to confirm a meniscus tear. If you've injured your knee in sport, bent it too far in, but it doesn't get stuck or locked, then you may have just strained the inside ligaments of your knee, the medial collateral ligaments. Arthritic pain tends to be on the inside as well, but in comparison it's a very diffuse pain, and it can be anywhere from the anterior tendon all the way to the back. Arthritic pain can vary with weather changes, is often swollen, can be stiff in the mornings or after sitting for a while, and if it's bad enough you'll often hear cracking and grating sounds coming from within the knee. A sneaky little one that can confuse some people is inflammation of the pes anserine bursa, a fluid-filled sac in this area, a couple of centimeters below the joint line on the inside of the upper shin bone. This will cause pain with exercise, possible puffiness, and is more common in women and overweight people. If we're talking the outside of the knee, we're usually talking about rubbing of the iliotibial band on the outer knee. This builds up in runners and cyclists, can click a bit or create a warmth and redness in this area. And some people get pain further up the iliotibial band, even to the outer hip. If you're feeling it further up than the kneecap, where the quads come in, that's usually tendinitis of the quadriceps muscles. For folks with pain at the back of the knee, there's 3 options, but it's fairly easy to distinguish between them. Usually it comes from the muscle that locks your knee when you fully straighten your leg, the popliteus muscle. When it's strained or has developed a trigger point, you'll feel that in the fold in the back of your knee. Now, if it happens to be a little bit further down and it hurts when you raise your calves, that could just be a calf strain. Now, if there's a big lump at the back of your knee, that'll be a Baker's cyst. Anyway, I hope that helps. If you liked the video, please consider liking and subscribing, and let me know how you go in the comment section below. Okay, cheers.